Okay, we're going to talk about doing a nasal intubation. So importantly, a nasal intubation can only be done if the patient is breathing. So they have to be breathing in order to do this. There may be a few steps that you take to prepare the patient's nose for this. One may be some places carry a nasal decongestant spray that causes the blood vessels in their nose to constrict, so you prevent like creating a massive nosebleed when you do this. You might also have some lidocaine jelly that you can use in the nose to kind of numb that up, make it more comfortable for the patient, and then you definitely want to lube your tube. So just like a normal ET tube. I would have all my equipment prepared just like for a normal intubation, as far as checking my cuff, having all my syringe attached, all my supplies out and ready. The nasal intubation uses a special tube called an Indetrol tube. It has this string with a little ring on it, and I'll show you what that's used for when we put it in. And then you also use this device called a BAM whistle, and that is going to go on the end of your tube here, just like that. So basically, I'm going to remove this NPA, and I'm going to direct the tube straight back. We're not going to go up, we're going straight back into the nose. I'm going to go until I feel like I'm probably close to the glottic opening, and then I'm going to start listening for a whistle noise from this red device here on the end of my tube. So when I hear a whistling noise there, that means the patient is breathing in, and so I want to advance the tube all the way when I hear it whistle, because that's going to give me the best chance of hitting the trachea. Also, when I advance it, I'm going to be pulling forward or pulling back towards me on this ring here, and that is ideally will move the tube anteriorly and direct it into the trachea. So again, I'm in the nose, I'm listening for the whistle. When I hear it, I'm going to pull on my string and advance the tube the rest of the way, and it's going to be buried all the way up to the connector. And that is nasotracheal intubation. You would obviously then take off your BAM whistle, put on your end-tidal CO2 and your BVM to confirm that you're in the trachea.